My name is Dr. Ben Sinclair and I run the Optimise Health Clinic. It's a private medical practice and we try to look after people who are too busy to look after their own health by providing convenient access to healthcare. We're based in the city centre, which means people can get to us easily and we work in an integrated way. I developed this model at medical school in 1998 and I woke up having had a very vivid dream of this sort of blue pyramid, which was a three-cornered pyramid rather than a square-based pyramid, which actually represented for me the biopsychosocial model we taught in medical school, but with the addition of the spiritual pinnacle, which then means that actually you can consider all aspects equally in health, and it then means that you can actually look at someone's health and work out where their health is being distorted or pulled in the wrong direction. And each area is linked to the other areas equally. So that was the kind of the basis and theory of the company. I trained as a GP up in Yorkshire and then started getting involved in independent work in about 2009 and started doing some screening medicals in the financial sector in Leeds, promoting health with talks, which then led to actually setting up a full private practice in York. And then in 2018 we moved down here to set up the Optimise Health Clinic in Birmingham, which is I think the best city in the UK at the moment. And we chose Birmingham because we think it's a really great base. There's a lot of busy working people here, so they need us. And also it's a great place to go out to the rest of the country from. Optimise is really centred around people's health needs. And so we've done some research that says that people won't walk more than 5 minutes from their place of work to access healthcare. So we want to be where they are working. So in the Birmingham city centre we have 2 sites straddling the city, which are convenient for anyone who works in the city centre of Birmingham. And we offer a whole range of services. So we do private GP appointments, we do in-house psychology, we have an interest in nutrition. We also have new products launching of menopause, because that's an up-and-coming issue that women are working through during their careers and they're staying at work. And so we're just launching that as a new product we're really excited about. And we also offer screening medicals, and not just your sort of tick box exercise, but something that's going to give you a plan for the year, which actually helps prevent disease occurring. In terms of prevention, we're launching a medical weight management service. Because people often struggle to lose weight, and even with lifestyle and best intentions, sometimes they need medicine to help them. Obviously the usual things like vaccinations, blood tests, private referrals and prescriptions we do as well. So really looking at having our new premises, which is on Cornwall Buildings, is going to be a really nice place to relax, almost have a spa-like experience of healthcare where you can actually deal with problems in enough time. With a range of doctors and range of specialties who can look after your needs. You run your own business and you want to have some health cover. We believe in health rather than just having insurance. So insurance might cover the hospital bit, but you've got to have that health bit first in the primary care setting. So to look after yourself sustainably, you might be, let's say, an SME. Or self-employed, but we also look after small to medium-sized companies and corporates. We tend to attract a lot of legal financial people because they understand that time is money and they want to keep their staff healthy and well, and we can do that conveniently, effectively. So I personally handpick employees. It's very difficult to find a doctor who actually treats people truly holistically and is truly patient-centred. So we screen lots of people and we select only the best people to work with us. But that also means we want to really retain them and look after them. So at the moment doctors are getting burnt out left, right and centre, and working independently is a way to prevent burnout. But if I was I don't know, purely about the business, I'd be sort of whipping my doctors into seeing hundreds of patients. But actually I believe that if the doctor is in a good position, health-wise and mental-wise, then their patients going to benefit, and there's some good evidence that actually if doctors are well, their patients get better quicker. So we try and look after our staff. We do yoga at lunchtime, we go to the gym before, during and after work. We try and promote sustainable working practices. We have time in the day to research and do our CPD, based on the cases that we see. So we become experts in every individual patient who comes through the door, because we believe that's actually good for the doctor, and it's good for the patient. So it's a win-win for business, it's a win-win for the doctor, and everyone goes home happy, everyone is in the best possible health. I run or cycle whenever I can to work, so we really believe in those kind of green issues. We have a minimum impact, we have a virtually paperless practice. The only thing we have paper for is when someone brings us paper, we have to actually print a prescription, but most things we do are electronic. So we're trying to really have that real kind of great environment to work in, and we have fun. I think work's got to be fun, and if people don't go home happy, then I don't think I've done a good job. We offer longer appointments, so our minimum appointments is 15 minutes. If someone comes to us for the first time, it'll be a 20-minute appointment minimum for a baseline of where they're at. We have our website, and you can book online, see our availability for appointments on there. We have Instagram, and we often promote sort of health messages through Instagram. We also put out a fair bit on LinkedIn, which is our most popular platform. I have a Twitter handle as well, and we do a Facebook page as well. We're looking at a rapid expansion model, and we're looking to have sites in key areas of the city of Birmingham, and we're looking for our third site right now. We're also looking at expanding to other cities, because we believe that this model works for working people, and wherever there are working people, we want to be. We're looking at adding services as they are needed. As we uncover a need for a particular service, we'll create it. We're very kind of small, dynamic and patient focused, so if someone wants something and get a business case together, we'll start doing it. But I think the future really is that Birmingham would be provided for in a really convenient, holistic and way of getting healthcare, which means that it's keeping people going. It's a massive, vibrant working city. There's some of the youngest people in the country, average population age here, so actually those people are going to be going through their working lives. We want them to get the best habits early on in their career to sustain them for the whole of their career, so that they don't get overweight, they don't get heart disease, they don't get diabetes, and they're happy throughout their career and hopefully live a long and happy life. Generally, I think I'm enthusiastic. I tend to be quite energetic as well. If I run into work, I'm even more energetic, and my staff often have to calm me down because I've got 101 ideas. And I'd like to think I would be caring as well. Best business moment of my life. I think the first day I started fully practicing as a private GP, and I realised that there was an endless possibility of ways to help people. Well, the power of kind of intuition and healing would be amazing. I think part of me has a desire to make people whole and happy. So on some level that is intuitive as an art rather than a science, and I definitely believe the spiritual element of that is something that kind of I appreciate. I have intuition about people, which they haven't told me. So, but if that was actually a thing where literally it just happened, they walked through the door and I said, you've got this, and I was able to just make them well again with their consent, that would be great. As a superpower, I think that would go a long way. And I found it really welcoming. So as someone who's relatively new to the corporate sector in Birmingham, I only knew a couple of people here when I arrived. It's been really friendly, and I felt quite included and quite welcomed. I'm not your typical downtown member, being a doctor rather than a sort of I'm a weird hybrid of doctor businessman. So, but it's been really great. I've really enjoyed it. So I think I've met some really interesting people. I've gained some clients, and I've learned so much about the city which I wouldn't have otherwise known.